So our primary endpoint was progression-free survival. The progression-free survival in patients who received Gefitinib alone was 8 months, and the combination of Gefitinib with chemotherapy doubled that progression-free survival. So the patients on the combination arm had a median progression-free survival of 16 months. So this was a very significant result. And this was our primary endpoint. It was a statistically significant difference. The hazard ratio was 0.51, and the p-value was less than 0.001. So this was a positive trial. Our secondary endpoints were overall survival and toxicity. Overall survival was also significantly prolonged. The median overall survival in the patients on the standard Gefitinib arm was 17 months, and the median overall survival in the combination arm was not reached. So the hazard ratio for the overall survival was 0.45, and the p-value was less than 0.001. So this was also a very statistically significant and a clinically significant result. In terms of toxicity, we evaluated all toxicities and not considering the paper toxicities, the asymptomatic electrolyte abnormalities and the hepatic transaminitis. So we counted the clinically relevant grade 3 and higher toxicities, and this was higher in the combination arm. So 51% of patients in the combination arm experienced clinically relevant grade 3 and higher toxicities as compared to 25% in the Gefitinib arm. So it was more toxic. However, I must emphasize that this is probably one of the only strategies that we can prolong overall survival in patients who have EGFR mutated non-small cell lung cancer. All of the landmark trials so far have prolonged progression-free survival, but to the best of my knowledge, other than in the Archer trial, there is no other strategy that prolongs overall survival in patients with EGFR mutant non-small cell lung cancer. So I think this represents a new standard of care in EGFR mutant non-small cell lung cancer, the combination of an oral TKI and chemotherapy. The reason I think that this works is that the tumor is heterogeneous, and there are multiple tumor clones, and probably the development of resistance, if you give a single therapy, is probably faster, and perhaps using a combination upfront delays resistance, and I think that's the key to prolonging survival in these patients.